Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin Choda with InTouchEMR.com, and in this video training I'm going to tell you how to simplify and automate patient intake. Patient intake can be the simplest yet the most time-consuming aspect of a practice workflow. Now, depending on how you're doing it, it can either be, like I said, simple, or if you seem to be adding additional steps to it, it can take more time than needed, and it can be an unnecessary burden on not just the time and the resources in your practice, but it can also cause billing issues down the line if some things during intake are entered incorrectly. I'm talking about the patient's date of birth, I'm talking about the spelling of the patient's first and last name, I'm talking about the actual address of the patient, as you probably know if you're in billing or if you know of common billing errors. One of the most common billing errors is incorrect information entered on patient intake. And that's, it's hard to accept that, because as a clinician you work so hard to do documentation, you work so hard to treat the patient well, and then when you get a denial because there was an error in one of the initials that you provided to the insurance company, the initial of the patient's, the middle initial, it's not fun. Okay, so how do you simplify and automate patient intake? This is what we do extremely well at InTouchEMR.com. Imagine if all you had was the patient's insurance ID number. Now, I don't know if you know this, but that insurance ID number can be used to actually pull the patient's information from the payer. Now, how is this done? Okay, let me show you. If this insurance ID number is sent to the clearinghouse, and there are different clearinghouses in the country, there's several of them. If the insurance ID information goes to the clearinghouse, and then from the clearinghouse, that insurance ID information goes to the actual payer. So let's say you're checking Aetna, for example. Now, Aetna, keep in mind, as one of the payers, already has information for the patient. They already have the patient's first and last name associated with this insurance ID. They already have the patient's date of birth associated with this insurance ID. They already have the patient's address associated with this insurance ID. If you can get the patient's permission in writing, and the patient is okay with you using their insurance ID to check their information, I'm talking about the actual demographic information. Okay, I'm talking about the demographic information to streamline a component of the patient intake. I'm not talking about eligibility. That's completely separate. Eligibility is separate and patient intake is separate. So eligibility and intake can be combined, but we're not talking about eligibility here. I'm actually talking about patient intake. If the patient gives you permission, what you can do is you can actually get the patient's full name, date of birth, and address, and use that to automatically create a patient record. Now, this is extremely powerful, because if you have a patient record that's created based on just the insurance ID of the patient, it can save you time in your practice, because now the front desk can do other more important things, like following up on referral sources, like following up with patients, following up on patient balances, reminding patients to show up for their appointment. There's so much stuff they could be doing that's more important than just manually putting in data in your computers. This is huge. I hope you see the potential of this. It is big. This is literally, this is to computers what Apple was, back in the PC age. This is revolutionary. I know it's a strong word, but this is really what it is. I hope you realize the potential of this. And by the way, this is exactly what we do with our web-based software, InTouchEMR.com, which actually, it doesn't matter what type of computer you use. Everything's done online. As long as you have access to a computer with an internet connection, we do this for you. Okay, so I hope you understand that. So once a patient record is created, what you've done is you've simplified and you've automated patient intake. Now keep in mind, this isn't going to have all the additional information such as the patient's social. It's not going to have, a patient's emergency contacts. It's not going to have specific information about the medical history of the patient. That's the kind of stuff that you have to acquire from the patient or from another provider, because then you have to get the patient to sign off on that. But I'm talking about basic elements such as the name, date of birth, and address, which can be acquired from the insurance company and can be used, therefore, to simplify and automate patient intake. Like I said, we do this with intouchemr.com. In fact, simplifying patient intake is one of the inability to simplify patient intake is one of the 5 biggest blunders associated with EMR systems. Providers don't realize that your EMR system should help you do this, and if it's not, then to be honest, it's a shortcoming in your EMR system. If you want a full color executive briefing on the 5 blunders to avoid with an EMR, go to our website, intouchemr.com, and ask us, and we'll just send it to you. Thank you so much for watching, and I wish you all the best, and I hope you're able to simplify and automate patient intake. We can do that for you with intouchemr.com, but even if you don't work with us, make sure to go to our website and request the executive briefing, and I hope we can help you simplify and automate patient intake. Don't forget to check out the rest of the videos on this channel. Thanks.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.